15 Symptoms of High Cortisol Levels. Hello, friends. Welcome back to our channel. In this video, we will discuss the 15 symptoms of high cortisol levels. Cortisol is a hormone that plays a key role in how your body manages stress. Produced by the adrenal glands, it's often called the stress hormone because it's released in response to situations that trigger your fight or flight response. But cortisol does more than just help with stress. It regulates metabolism, controls blood sugar levels, helps reduce inflammation, and even aids in memory formation. While cortisol is essential for many bodily functions, abnormal levels, whether too high or too low, can have negative consequences. Chronically elevated cortisol levels can lead to issues like weight gain, high blood pressure, mood swings, and weakened immune function. On the other hand, too little cortisol can cause fatigue, muscle weakness, and poor stress management. Understanding how cortisol affects your body is essential for maintaining good health and preventing long-term complications. So, let's get started and learn about 15 symptoms of high cortisol levels. 1. Weight gain. Weight gain around the abdomen and face is a common and significant indicator of elevated cortisol. This specific fat distribution is linked to cortisol's role in regulating how the body stores fat. Cortisol is a hormone released in response to stress, and it stimulates the liver to produce glucose. However, when cortisol levels are consistently high, the body stores more fat, particularly around the midsection. This is because cortisol increases insulin resistance, leading to higher insulin levels, which encourages fat deposition in the abdominal area. The face often swells, a condition called moon face, due to fluid retention and fat redistribution. This type of weight gain is more than just cosmetic. It can increase the risk of developing metabolic syndrome, type 2 diabetes, and cardiovascular diseases. High cortisol also triggers cravings for high-fat, high-sugar foods, worsening the cycle of weight gain. Managing stress through lifestyle changes such as regular exercise, adequate sleep, and mindfulness practices is essential to prevent this. Reducing alcohol and caffeine intake can help lower cortisol production, as both can exacerbate stress responses. Early detection and intervention are key to avoiding long-term health issues. 2. Fatigue and severe tiredness. Fatigue and constant tiredness are common signs of elevated cortisol levels, primarily because cortisol affects energy metabolism. When cortisol is elevated, the body is in a prolonged state of stress, which triggers the release of glucose to provide energy for a fight-or-flight response. However, this constant state of alertness over time depletes the body's energy reserves. Instead of replenishing energy during rest, the body struggles to recover, leading to persistent exhaustion. Elevated cortisol also disrupts sleep patterns by interfering with melatonin production, crucial for a restful night's sleep. Even if you sleep for hours, the quality of rest diminishes, leaving you feeling drained the next day. Fatigue can be particularly severe in individuals with chronic stress, adrenal fatigue, or Cushing's syndrome. To mitigate these effects, it's essential to adopt stress reduction techniques like meditation, yoga, and adequate sleep hygiene. When done moderately, exercise can also help reset the body's stress response and reduce cortisol levels, improving energy levels. Adequate hydration and a balanced diet rich in nutrients like magnesium, which helps regulate stress, are key to combating fatigue caused by high cortisol. 3. High blood pressure. High cortisol levels can significantly impact blood pressure regulation. Cortisol influences the body's salt and water balance by increasing sodium retention in the kidneys, which leads to water retention and higher blood volume. This increased fluid in the blood vessels puts additional pressure on the cardiovascular system, raising blood pressure. Chronic stress and elevated cortisol levels also lead to increased constriction of blood vessels, exacerbating the problem. Over time, high blood pressure can increase the risk of cardiovascular conditions such as heart attacks and strokes. High cortisol also raises sensitivity to the hormone epinephrine, adrenaline, which can further elevate blood pressure during stressful situations. managing blood pressure when cortisol levels are high involves adopting a heart-healthy diet that is low in sodium, engaging in regular cardiovascular exercise, and practicing relaxation techniques such as mindfulness or deep breathing. Addressing stress management early can prevent long-term complications. Reducing caffeine intake and ensuring consistent sleep patterns can also help maintain healthy blood pressure. 4. Mood swings, including anxiety and depression. High cortisol levels are closely linked to mood disturbances, such as anxiety, irritability, and depression. This occurs because cortisol disrupts the balance of neurotransmitters, including serotonin and dopamine, which play key roles in regulating mood. Prolonged stress elevates cortisol, leading to overstimulation of the brain's emotional centers. Over time, this constant cortisol elevation reduces the brain's ability to respond effectively to stress, making mood swings more frequent and harder to control. Chronic stress also leads to the depletion of serotonin, contributing to feelings of depression and anxiety. Managing mood swings associated with high cortisol often involves integrating physical activity into daily routines, as exercise helps reduce cortisol and boosts serotonin production. Cognitive behavioral therapy, CBT, and mindfulness meditation also manage stress and regulate mood. Ensuring adequate sleep and reducing stressors in daily life are important steps in maintaining emotional stability. If mood disturbances persist, professional counseling or therapy may be necessary to address the underlying psychological effects of elevated cortisol. 5. Muscle weakness. Muscle weakness is a key sign of elevated cortisol because cortisol promotes the breakdown of proteins in muscles to generate glucose for energy, especially during periods of chronic stress. This process, known as gluconeogenesis, is meant to provide energy in the short term, but can have harmful effects when cortisol remains elevated. Over time, muscle proteins are continually broken down without being adequately replenished, leading to muscle atrophy and a gradual loss of strength. This is often seen in conditions like Cushing's syndrome, where cortisol levels are persistently high. Muscle weakness can make daily tasks more difficult and lead to injuries or prolonged recovery times. Strength training exercises can help rebuild muscle mass to counteract muscle loss, and a protein-rich diet is essential for muscle repair. Additionally, stress management techniques to lower cortisol levels are critical for preventing further muscle degradation. 6. Difficulty concentrating. Cognitive difficulties, including trouble with concentration and memory, are common in individuals with high cortisol levels. This is because cortisol affects the hippocampus, a region of the brain responsible for learning and memory. When cortisol levels remain high, it causes structural changes in the hippocampus, leading to impaired cognitive functions. Over time, high cortisol levels can even shrink the hippocampus, making it harder to retain new information or stay focused on tasks. In stressful situations, the brain prioritizes survival responses, which can interfere with higher-level thinking. Managing stress through mindfulness, regular physical activity, and brain-stimulating exercises such as puzzles or reading can help improve concentration and memory. Engaging in practices that calm the mind, like deep breathing or meditation, can also lower cortisol levels, helping to restore cognitive function. A nutrient-rich diet, especially one that includes omega-3 fatty acids and antioxidants, can support brain health during times of stress. 7. Headaches. Frequent headaches, especially tension headaches, can result from high cortisol levels. Stress triggers the release of cortisol, which affects the blood vessels in the brain. Cortisol can cause these blood vessels to constrict, reducing blood flow to certain areas and leading to headaches. Tension in the neck and shoulders, common during stress, also contributes to headaches. Furthermore, sleep disturbances caused by high cortisol can exacerbate the frequency and intensity of headaches. Regular hydration, proper posture, and stress-relieving techniques, such as stretching or yoga, can help alleviate tension headaches. Reducing screen time and maintaining a regular sleep schedule can also prevent stress-related headaches from becoming chronic. 8. Increased thirst and urination. Increased thirst and frequent urination are common symptoms of high cortisol levels, often stemming from cortisol's effect on the antidiuretic hormone, ADH. ADH helps the kidneys maintain proper water balance, but elevated cortisol reduces ADH production, leading to increased urine output and dehydration. This loss of fluids triggers excessive thirst as the body attempts to restore its water levels. These symptoms can also mimic early signs of diabetes, as both conditions involve dysregulated blood sugar and fluid balance. It's important to stay hydrated and monitor fluid intake to manage these symptoms. However, addressing the underlying stress and cortisol levels is essential for long-term relief. Stress management practices such as yoga, adequate sleep, and limiting caffeine and alcohol intake can help regulate cortisol and restore fluid balance. 9. Thinning skin with easy bruising. Cortisol has a significant effect on skin health, particularly by reducing collagen production. Collagen is vital for maintaining the skin's strength and elasticity, but elevated cortisol levels impair the body's ability to synthesize collagen. This leads to thinner, more fragile skin that bruises easily, even with minor impacts. Individuals with high cortisol levels might also notice that their skin heals slower from cuts or scrapes. Proper skincare routines, including moisturizers rich in vitamins A and C, can help support skin health during periods of high stress. Eating foods high in antioxidants, such as berries and leafy greens, can also promote collagen production. Reducing stress is key to preventing further skin issues. 10. Slow wound healing. High cortisol levels suppress the immune system, which plays a critical role in wound healing. Cortisol reduces the production of cells involved in inflammation and tissue repair, which are necessary for healing injuries. This suppression means that wounds take longer to heal, and there is an increased risk of infection. Zinc, vitamin C, and protein are particularly important for wound healing, and ensuring adequate intake of these nutrients can help counteract the negative effects of high cortisol. Lowering stress levels also improves circulation, ensuring that oxygen and nutrients can reach the injury site more efficiently, promoting faster recovery. 11. Increased facial hair in women. In women, increased facial hair, or hirsutism, can indicate elevated cortisol levels. This occurs because cortisol can lead to an increase in androgen production, which is typically higher in men. When cortisol levels remain high, androgens are produced in excess, leading to male pattern hair growth in areas like the face, chest, and back. This condition is often seen in disorders like Cushing's syndrome, where cortisol production is chronically high. To address this, doctors may recommend treatments that reduce androgen levels, such as hormonal therapies. Reducing cortisol through stress management is also critical to balancing hormone levels. Physical activities like yoga and Tai Chi, along with stress-reducing practices such as mindfulness meditation, can help lower cortisol and reduce the impact of hormonal imbalances. 12. Irregular or absent menstrual periods. High cortisol levels can significantly disrupt the menstrual cycle by altering the balance of reproductive hormones. Cortisol affects the hypothalamic pituitary gonadal, HPG, axis, which regulates the release of hormones essential for menstruation. When elevated, cortisol inhibits the production of gonadotropin-releasing hormone, GnRH, which signals the pituitary gland to release hormones that stimulate ovulation. Without regular ovulation, periods can become irregular or stop entirely. This disruption also affects estrogen and progesterone levels, which are crucial for a healthy reproductive cycle. In women with high cortisol levels, such imbalances can lead to infertility and other reproductive health issues. A balanced diet, rich in healthy fats and essential vitamins like B6 and magnesium, can promote regular menstrual cycles by supporting hormone production. 13. Erectile dysfunction or decreased libido in men. Elevated cortisol can significantly affect sexual health in men by interfering with testosterone production. Cortisol and testosterone have an inverse relationship. When cortisol levels rise, testosterone production decreases. High cortisol can lead to reduced libido and, in more severe cases, erectile dysfunction. Stress is a major contributor to this imbalance, as the body prioritizes the production of cortisol over reproductive hormones during prolonged stress. Managing cortisol levels through stress reduction techniques, such as regular exercise, mindfulness, and relaxation, can help restore testosterone levels and improve sexual function. Men experiencing persistent symptoms should consult a healthcare provider to rule out underlying conditions and explore treatment options. In some cases, hormone therapy or lifestyle adjustments may be recommended to improve sexual health and lower cortisol levels. 14. Bone loss or osteoporosis. Bone loss is a critical consequence of elevated cortisol levels because cortisol interferes with calcium absorption and inhibits bone formation. Cortisol reduces the activity of osteoblasts, the cells responsible for building new bone tissue, while simultaneously increasing the activity of osteoclasts, which break down bone. Over time, this imbalance decreases bone density, making bones more fragile and prone to fractures, a condition known as osteoporosis. Additionally, cortisol decreases calcium absorption from the digestive tract and increases calcium excretion through urine, further weakening bones. Individuals with chronic stress or conditions like Cushing's syndrome are at a higher risk of developing osteoporosis due to prolonged exposure to high cortisol levels. To mitigate this risk, weight-bearing exercises such as walking or strength training can promote bone density. Consuming calcium and vitamin D-rich foods or taking supplements, as a healthcare provider advises, is essential for maintaining bone health. In severe cases, medical interventions like bisphosphonates may be required to help slow bone loss. 15. Sleep disturbances. High cortisol levels can severely disrupt sleep patterns, leading to insomnia or poor sleep quality. Cortisol follows a diurnal rhythm, with levels peaking in the morning and decreasing throughout the day, allowing the body to rest at night. However, this rhythm is disturbed when cortisol is consistently elevated and cortisol levels remain high in the evening, making it difficult to fall asleep or stay asleep. Chronic stress often causes this disruption by activating the HPA axis, which leads to sustained cortisol production. The resulting sleep disturbances can create a vicious cycle, where poor sleep further elevates cortisol, exacerbating the problem. Improving sleep hygiene, such as sticking to a regular sleep schedule, limiting caffeine, and creating a calming bedtime routine, can help lower cortisol levels and improve sleep quality. Relaxation techniques like meditation or progressive muscle relaxation before bed can also reduce stress, promoting more restful sleep. If insomnia persists, consulting with a healthcare provider may be necessary to identify other contributing factors and explore treatments. If you found this video helpful, don't forget to give it a thumbs up and subscribe to our channel for more health-related insights. Managing stress is vital for keeping cortisol levels in check, and we'll be sharing more tips on how to do just that in our upcoming videos. Drop a comment below if you have any questions or want us to cover specific topics. Stay healthy, and we'll see you in the next video.